Milano,
Paris,
Bruxelles,
Lisboa,
Tallinn,
Madrid.
Climate change is a real threat to Europe. It's not just a problem for the environment. It affects our energy and food security, water resources, financial stability, and the health of our citizens. But as we all know, humans have a knack for adapting and overcoming challenges. Otherwise, we wouldn't be here having this discussion. Welcome back, I'm Hermine. In this new series, we'll take a look at 3 challenges to this amazing human ability to adapt. How can we deal with the effects of climate change on our well-being as city dwellers and on our food security? And what about health? This is where we're starting today. Climate change presents a fundamental threat to human health. That's not from me. It's a quote from the WHO, the World Health Organization. And as the fastest swarming continent, Europe finds itself in a particularly sticky situation. Heat waves have been a growing public health concern in Europe recently. Professor Hans Orru from the University of Tartu in Estonia has a pretty shocking stat to show how this affects Europeans.
Last summer, around 60,000 more people died in Europe than usual because it was too hot.
How does heat impact our health? When it's really hot, your body might have a hard time keeping its temperature in check. This can lead to exhaustion and even heart stroke. Heat waves are set to become more regular, intense and long-lasting in Europe. This will increase the risk of heat-related illness and death, particularly among our most vulnerable citizens. Here's Theodora Psaltopoulou, a professor of therapeutics, epidemiology and preventive medicine at the National and Kapodistrian University of Athens.
It is therefore essential that these groups, especially during acute phases, such as a wildfire or period of extreme heat, remain in controlled environments as much as possible, have easy access to water, stay hydrated, and are supported by a caregiver, usually an adult. If symptoms worsen, or if a previously healthy individual suddenly develops issues such as headache, fever, or neurological symptoms, immediate first aid must be provided, followed by transfer to a healthcare centre or medical assistance.
Air quality also gets worse during heat waves, and people with respiratory problems like asthma or chronic lung disease, as well as those at risk of heart disease, may experience worsening symptoms. This problem is made even worse by fires, smoke and toxic particles. Dr. Giuliana Delimonte, who's the Deputy Director of the Luxembourg Ministry of Health, explains the situation.
We know that high temperatures lead to poorer air quality, for example due to the high concentration of ozone or fine dust, which also puts a strain on the heart and lungs. And people who already have problems, respiratory problems in the future, are particularly affected. Or in the case of asthma or chronic obstructive pulmonary disease, or even general heart problems.
She says this will definitely have a big impact on the hospital system, including more consultations and more demand to emergency services during times of extreme heat. To help public authorities deal with these challenges, the WHO has produced guidance on improving public health responses to protect public health during heat waves, says Zornica Spasova, a researcher in the field of climate change and public health at the Bulgarian Ministry of Health.
Many countries, including in the EU, are implementing them, something that can reduce summer mortality during heat waves by some 90%.
The WHO sets out the measures to be taken at various levels. This includes setting up early warning systems, spreading public health advice quickly, and getting health and social systems ready to respond. But some member states, including Bulgaria, Spasova's own country, are lagging behind. The EU has also been helping member states get ready for heat waves, not just with funding, but with some practical tools. One of them is the European Climate and Health Observatory. It's a hub where countries can find data, research, and even an AI assistant that helps them explore what Europe's experts already know, from temperature trends to ways of keeping people safe when the next big heat waves hits. The EU also supports at least 150 European regions and communities to be more climate resilient by 2030. Climate change isn't just about global warming, it's also about all sorts of extreme weather events. It's making floods and droughts more common and intense. Water scarcity and water stress can also cause health problems, especially in southern Europe. And that's not even getting into the effect on farm yields and food security. Romanian climatologist Roxana Boiariu explains how flooding affects water quality and increases the risk of waterborne diseases. She's a climatologist and head of research on climate at Romania's National Meteorological Administration.
In the Mediterranean region, we are already dealing with water resource problems. These include poor water quality and problems that can have an impact on public health. Flash floods, which are a consequence of increasingly intense rainfall as a result of global warming, also reduce water quality. There are diseases that are transmitted, unfortunately, in the case of floods, diseases that involve all kinds of vector pathogens.
Indeed, flooding combined with higher temperatures and milder winters can encourage the spread of disease-carrying insects in Europe. These insects leave their original habitats to develop and reproduce in all regions. Ticks and tiger mosquitoes in particular pose an epidemic risk as they can carry and transmit diseases such as dengue fever, West Nile virus, chikungunya, and Lyme disease. And these are becoming a real problem, even in countries as far north as Luxembourg, says Dr. Dalimonte.
We know that climate change, for example, allows the spread of mosquitoes and ticks. And the Aedes albopictus, or Asian tiger mosquito, is a potential vector for dengue and malaria, viral diseases that are usually more prevalent in tropical and subtropical endemic areas. We are keeping an increasingly close eye on this here in Luxembourg, as well as in the south of Europe, and we are starting to work closely on it at the European level.
There's the saying that says forewarned is forearmed. But Italian infectious disease specialist Federico Gobbi says we're still not very informed or prepared for these new diseases. So we need to raise awareness among healthcare professionals and make sure testing lab services can be efficiently mobilized. And finally, we need to step up our research efforts.
Then there is the important areas of research, because these are diseases for which it will be very difficult to find antiviral drugs. However, progress could be made in terms of a vaccine against dengue fever. Vaccines already exist for chikungunya, but for West Nile virus, there is only a vaccine for horses.
There is no vaccine for Lyme yet, but there are vaccines for tick-borne encephalitis. To stop this from becoming a public health issue, Ieva Budraitė, a sustainability expert and the chair of the Lithuanian Green Party, suggests offering free vaccinations to citizens.
The fact is that today people have to pay, and quite a lot, relatively speaking, to protect themselves from such conditions, which later, if someone gets Lyme disease, for example, the whole of society will have to pay for. Well, I think we should already have discussed this, but it must now be included in our immediate plans.
We should also try to reduce the number of mosquitoes and other disease carriers by stopping them from reproducing and developing. Daniel Buda, a Romanian MEP from the centre-right EPP group, explains what could be done to prevent the spread of these pests.
If we take the tick, for example, let's put crop rotation to use, because the tick is an insect, well, a worm, that lives in pastures, in meadows. A balanced intervention, such as crop rotation, can break the tick's biological food chain. If we're talking about mosquitoes, we need to prevent flooding, because these insects are especially active in flooded or flood-prone areas, and you obviously need to intervene sequentially, but at the same time with maximum care, so as not to kill pollinating insects.
And the same goes for all these extreme weather conditions. As well as causing or exacerbating health problems, they can also affect the delivery of public health services, how well the whole health facilities work. This includes the logistics behind such as the production, the transport, or distribution of medical supplies. And last but not least, we should also consider the impact on mental health. He says that urbanization and deforestation are also making it easier for zoonoses to develop. Zoonoses are these infectious diseases that spread from animals to humans. And with all these real risks of disease spreading and regional epidemics, there's also the threat of a new pandemic.
The reality is that every year we have had 1, 2, or 3 pandemic threats. In other words, the COVID-19 pandemic was a pandemic waiting to happen. And this risk will only increase. The risk will increase because there is deregulation of wildlife trafficking, and there is progressive deforestation that brings wild animals into closer proximity with people.
He says that this has to be a long-term political priority on the international stage. Our Greek expert Psaltopoulou agrees.
The World Health Organization has long warned about various scenarios involving viruses and bacteria that, due to climate change and other reasons, could spark a new pandemic. That is why the lessons learned, unfortunately in a painful way, from the COVID-19 pandemic are so important. 5 years ago, for instance, we did not even have enough masks for the global population, whereas now they are widely available at low cost. Progress is also being made in the development of new antiviral drugs, in the rapid genetic identification of viruses, and in information sharing across the world. We are becoming a global village, where something emerging in China can quickly affect the entire planet.
Psaltopoulou adds that working together internationally is the best way to deal with this risk. Dr. Dalimonte, a Luxembourgish expert, sees these challenges as a chance to boost cooperation and make Europe stronger and more united.
I would like to conclude that climate change should not only be seen as a threat, but also as an opportunity to strengthen European solidarity, and of course solidarity at a national level too, and thus to promote innovation, to move forward using new means such as AI or other technologies, and to collaborate.
And I'll let Romanian climatologist Roxana Bogariu have the last word.
Our species has thrived through its adaptability. However, in the past, climate change has occurred over much longer periods of time, in such a way that behavioural changes could ultimately be harmonised within these long timescales. The problem is that now we are experiencing a much more rapid pace of change, with the timescale on which current global warming is taking place being of the order of hundreds of years or even decades, because it is really picking up pace. Clearly, there is a climate emergency.
The problem is that Europe is currently bombarded with priorities and no longer knows where to focus. The pandemic already seems like ancient history, considering all the challenges that have cropped up since the war in Ukraine, the rapid progress of artificial intelligence, and the political instability we're witnessing all over Europe, to name but a few. However, safeguarding public health is too important an issue to put on the back burner. Don't you agree? I'd like to say a huge thank you to my colleagues for gathering these interviews across Europe. Alejandro from Portugal's Radio Renascença, Augustin from Lithuanian Junior Radias, Julia from Italian Radio 24, Jean-Claude from Luxembourgish Radio 100.7, Mart from Estonia's Kuku Radio, Nikos and Mariana from Greece's Sky Radio, Olia at Bulgaria's BNR, and Stefan from Radio Romania. Make sure you tune in for the next episode in our climate adaptation series, when we'll be looking at how city administrations can help their populations adapt to our changing climate. That's for our next Tomorrow's Europe episode. Until then, enjoy today.